I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
So we're here today at the Developmental Disabilities Nurses Association annual conference in New Orleans, Louisiana. And our guest on today's podcast is Dr. Owen Doody from Ireland, right?
Yes, correct.
All right. So you gave the keynote address just a few minutes ago.
Yes.
What did you talk about?
The keynote address was on the value and contribution of intellectual disability nursing in Ireland with developmental disability here in the US. And I suppose it's based upon my 30 years experience working in the field of intellectual disability in Ireland as a researcher, healthcare provider, and an academic.
So how did you get into this field?
Okay, I suppose my interest was always sparked as a child in caring for people. I had a sister 7 years younger than me, and I was always interested in looking after people. And I suppose that's the start for a basis for everything. And a neighbour of mine worked in the area of intellectual disability, and my interest was around people that needed support, and I identified disability and older people. So I went and did work experience in both, and I just loved the aspect of intellectual disability or developmental disability in the sense that, you know, there's great satisfaction in supporting and enabling people, and I suppose enabling them to make small changes or small strides in their life, and the smallest things are often the most meaningful things in life, and people up to with more complex needs. And supporting from a nursing perspective. But my initial interest was just helping and the small steps. And then when I went in as a student nurse training, got exposed more to the people with higher needs. And that became just as rewarding and as fulfilling, and if not more rewarding and fulfilling.
So you're a nurse in the field, and you tell me a little bit about what you did nursing-wise and how you ended up where you are today.
Okay, so in Ireland we have intellectual disability nursing as a separate entity and specialism and qualification in the nurse register in Ireland. So that will be slightly different. Ireland and the UK are the only two.
That's a positive thing. I would certainly see.
Massive positive. So we see ourselves as highly specialised, trained individuals for dealing and supporting with this population group. Just like you have people working with older people or maternity or children, we have acknowledged intellectual disability in Ireland. I suppose my career started out as a student nurse. Back then it was a 3-year training program, apprenticeship style model. And after that I worked with parents and children with developmental disability, and I continued on my education because to get to a degree level, and that gave me, I suppose, more knowledge and more information and more desire to implement things with parents and support parents of children with developmental disability. And I suppose from there, I suppose everyone thinks of a career pathway, and in nursing we have a career pathway. And you know, after student to staff nurse, I went into nurse management, and I managed an area for people with complex needs and behaviours that challenge, and that was diverse and interesting, and working with families again, and managing staff. And sometimes, you know, to be honest, you know, the reality is that sometimes staff can be the challenge.
You're right. I can agree with that.
Yeah, and I suppose that's something that, you know, from my perspective, it's about communication and about dialogue. And where you always have dialogue, you have less problems. So
you're right, and sometimes we can be the challenge ourselves too. So everybody has their own challenges at different times. You know, I want to go back to one thing you said about satisfaction earlier, and the satisfaction of working in this field. Because one of the things that I want, the message I want to get out is that there is a lot of satisfaction. This can be a very fulfilling career for people.
Yes, and as I said, it's the small things, you know. So, like if you were working with a young child that's trying to learn to feed themselves, you know, like that's a skill for life, you know. So you contribute to that. You you put in an intervention. I talked about backward and forward chaining, and forward is, the step from picking up the spoon to getting the food on the spoon to bring the spoon to the mouth. But in disability, we work backwards on everything, because the reality is, to teach a skill, you have to have success. Everyone likes to succeed, and if they succeed, they will repeat it. So when we're teaching something or supporting a person, we work backwards. So there always is that sense of success for the client, and you're able to develop the skill in the opposite way around, which is people find difficult. So it's like teaching your child to use the toilet. You praise them and acknowledge them when they have it used and when they flush the toilet. Not when they sit on the toilet. So
right. You're right. You're right.
So I suppose it is about the importance of understanding development, understanding needs, understanding how we live life, how we develop, and how we communicate, and how we do our tasks in life, and supporting the person in that.
And you're right about those little things that many people take for granted, like being able to bring a spoon to your mouth and eat. Mm-hmm. If you can help someone who doesn't have that ability or that skill to do something that small, it can have a major impact in their lives.
Yeah, and for people starting out, like most people that are going to be choosing the career for intellectual disability or developmental disability are probably young. They probably have exposure to grandparents, and I'm sure they find caring or being with their grandparents very rewarding in supporting their grandparents, being there with them, listening, all those things. So that's what you can get in ID or developmental disability as well. So it's that sense of, being present, the sense of fulfillment, satisfaction, in enabling someone else's life to be more comfortable and better and meaningful to them. And that's a very powerful part. And we all are human, and one of the things we crave as humans is closeness and contact, and that's something you will get in developmental disability or intellectual disability.
I could not agree more with that. It's great stuff.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
So we're thinking about health issues, health and wellness, and health equity, where everyone has an equal access and an opportunity to get health care that is appropriate for them or that works for them. What are some of the challenges that you might see that in this day and age? There's
many challenges, and I suppose the first challenge is at the personal level, with the family. First of all, they're often scared of a system. They're scared of how their child will cope in that system. Things may affect their child that don't affect someone with a so-called normally typical child, in the sense that lighting might be a trigger to overstimulate them. Noise might be things that they don't like, unfamiliar environments. So at a humanistic, basic level, you have those challenges, and engaging with the parents and supporting the parent and supporting the person. And then it is the system itself. The system is set up for the majority, and I'm not saying it shouldn't be, but there has to accommodate a reasonable adjustment for people, and reasonable adjustments are part of legislation. But how do we look at those reasonable adjustments? Do we know that the person with disability is coming? Do we give them an opportunity to identify what time is most appropriate to them? So my child might, if has a disability, might like to get up at 10 o'clock every day, but yet they give me a 9:30 appointment, So it's those accommodations in the system. But to be fair to the people in the system, they often don't know either that the person has a disability coming, because, it probably is a self-disclose aspect. There's no big red flag on someone's admission record, and there shouldn't be, because that's labelling and maybe stigmatizing as well. So it's striking the balance. So I suppose it is, do we have a channel for them to engage in? So one of the things that we've commenced would be a patient advocacy liaison service in a hospital, and that they can liaise with that. We can set it up. Is it do they prefer an early morning when it's quiet? Do they prefer an afternoon? Maybe I was talking to the team there last week, and they closed off a corridor for someone to come in, so to be completely have the sense of being secure. So it is the system. In fairness, sometimes can make the adjustments, but they have to know the adjustments. But people don't feel that they can make their needs known as well, and that's probably the biggest challenge. And everyone has needs. That's the person, the family, but also the staff. And people are sometimes afraid to articulate their needs because it's not expected that they would have these. Whereas we should maybe turn it around, that we expect everyone that coming into a hospital situation is vulnerable and needs some level of adjustment. I can remember, I remember going years ago into a restaurant, and I was given a little, what would look like a phone, and it buzzed and lit up when I was collecting my order. And we expect people to sit in waiting rooms
with that.
Well, surely there's an adjustment we can make, that if they need to go for a walk or need a quiet space or whatever, right, that there's a system that alerts them that they need to come back. And
some things are that simple. It's just thinking about it, right?
Yes,
and educating the system, educating people who work in the system and hospitals to make an environment. I think we kind of call it universal design. That's open for everyone, that works for everyone, that's accessible to everyone. So you talked about some challenges. So we're going to do something here. I call it 3 and 3. All right. So I'm going to set my little timer here.
Okay.
And you're going to have 3 minutes to give me 3 things that people who are listening here can maybe do in their own community, in their own states, their own countries, their environments, that you think can have a positive effect on general well-being and health and wellness and supports for people with intellectual and developmental disabilities. All right. So are you ready? Okay. Here we go. 3 minutes.
Okay, so I suppose the first thing would be a social thing in relation to the likes of Special Olympics Ireland and Special Olympics International. So they have health campaigns in them. They do health screening, but people can volunteer and support people with disability, the programs, athletics programs, and get exposure and integration to people with disability and their families. And I suppose an understanding of the needs and awareness of the needs and the diversity. And I suppose one of the things for me would be, not everyone is the same, and people often think people with disability are all the same.
Right.
Too.
Right.
So I think that would be the first thing. So that would be a social exposure. I suppose from a family perspective, then, and to integrate into the health system, something like a health passport, ensuring that they have a health passport for their child, explaining who their child is, their likes or dislikes, how they like to be communicated. The simple thing: how distance, do they like someone to come close to them or step there? Do they prefer space? All those things that were previous medical history, how they reacted, how they communicate their needs, if they've had experienced pain but previously, how they experienced it. So that when you're going meeting a healthcare professional, that you can give them this document and say, this is my child. Look over it, and if you have any questions, you can address my child and myself. So I think that would be a positive to change the system. So that's the social, the professional, and I suppose then at a policy level, would be that there's representation for key stakeholders, and key stakeholders representation is important, and I think people try to do it, but a lot of the time it's tokenistic. The real key stakeholders are people with disability and the families themselves.
Yeah. Well, you succeeded. You have a minute left. And so I'm going to expound on one of the things that you said, and that's the health passport. There are examples of health passports that are widely available. And for listeners out there who work in this field, if you're not familiar with one, get online and look for health passports, because they really can provide a snapshot of the person's some health issues, but it's that communication skill, all of these other things, the likes, the dislikes, how do they express pain? And that kind of information is so valuable to facilitating better healthcare visits because the clinician can understand the different ways that person might communicate as well.
Yeah, and I know we're a smaller country, Ireland, but I suppose we looked at that, and I was involved in the national steering group on it. And one of the things that was identified was that different organisations or different services or families have their own, and it can be very frustrating if you're it's different documents, and what's on page 2 is on page 20, and on this one. So I think that's what I'm saying. That would be maybe a national standardized, a national document would be helpful. So if I'm on holidays in New York or I'm in Utah or Illinois or wherever, that it's the one document, and people, staff in hospitals or care centres or community centres are aware of and familiar with this document, the one document.
Yeah, that makes perfect sense. Well, Dr. Doody, I really appreciate you taking the time to be with us today. I think people will love hearing your insights from Ireland. And again, just thank you for being here and for the work that you do every day.
No problem. Thank you.